Welcome to today's episode of the Owning Your Menopause podcast. I am super excited for today's guest. She is known as the Gut Health Doctor, is a registered dietitian and one of the UK's leading experts in gut health. With a PhD in gut health from the University of Queensland, Dr. Rossi has dedicated her career to researching the complex relationship between the gut microbiome and overall health. She is a practicing clinician, founder of the Gut Health Clinic in London, and an accomplished author known for her books on gut health and plant-based eating. She has an evidence-based approach which has made her a trusted voice in nutrition and gut wellness, especially for women navigating menopause. I am so delighted to welcome you to today's episode. It is the wonderful Dr. Megan Rossi. Thank you so much for agreeing to come on the Owning Your Menopause podcast.
It's an absolute pleasure. I'm really passionate about kind of empowering women with really practical strategies because it is tough being a female, right? Our hormones are just all over the place throughout our life stages. So yeah, just a little tips and tricks that help it be that much easier to be a female, essentially.
Yeah, and also I'm sure we'll come on to it at some point, but there is an awful lot of misinformation as well. So it's really important to bring this conversation to the forefront with experts in this field so that women can get that evidence-based, correct, practical, sustainable information. So I'm really excited for this. But I want to go back a little bit because what I like to do with my guests, just to start with, is to get the why did you start your journey into gut health research and what inspired you to specialise in that area?
Yeah, so I guess my journey into gut health began back in Australia. I actually grew up on a farm in Australia, so I'm a bit of a farm girl, which is obviously very different to London life. But I was doing all the things that we now know is good for the gut. Obviously, back then had no idea, but playing in the dirt, eating all the fresh fruit and veg, and that sort of thing. But I guess my first conscious encounter with the gut was sadly, not a happy one when I lost my grandma to bowel cancer. And, bowel cancer is the third biggest cancer killer in the world. So I'm sure a lot of people listening to this can relate to, having lost someone. Grandma was really close to me. And it was kind of my first, adult-y sort of death. And I hated the gut essentially. So I was in my final year studying nutrition dietetics and was like, God, we didn't really learn that much about this organ. So I had a really negative relationship with it. Then I graduated, started working as a dietitian in two very different settings. So one in the hospital setting, we're working with people who had, all different chronic conditions, kidney disease, heart disease, different cancers, obesity, a lot going on. And then I was also working in a very different population with elite athletes. So I was the nutritionist for the Australian Olympic synchronized swimming team. And it was this contrast in these, populations. The fact that both of them were coming to me complaining of the gut, this organ that I hated. It's like, what is going on? And that was like 2010, kind of before gut health, really started to surge. And there wasn't really that much research available at that stage. So I thought, you know what, I owe it to my grandma and to my, patients and clients to find out more about this kind of mysterious organ that no one was really talking that much about. And I did a PhD in the space, looking essentially whether we target the gut through the right nutrition, whether that can not just help with the, those frustrating but pesky gut symptoms that around 30% of people struggle with, like bloating, constipation, but more broadly, could targeting your gut improve things like your heart function, your kidney function, your mental health? And it was that PhD that completely transformed my relationship with the gut. I was like, wow, actually, I'm so sorry for all the swear words I said about you, gut. You were just misunderstood. And I didn't know how to, look after you. And I think the whole population, didn't really understand the power and potential. And I knew very much at that stage that I wanted to dedicate the rest of my career to gut health because, I knew I could improve people's in very real, but often surprising ways. Because at that point, we were seeing all the organs as isolated organs. And I think it's this discovery around the gut in particular, those trillions of bacteria that live within it, which scientifically we call our gut microbiome, that actually is kind of connecting all these organs, because these little microbes is actually doing so much and communicating with all of the organs in our body. So that kind of got me into gut health, and like I said, I knew gut health was where I wanted to continue my career. So Australia is very far away, and I knew I needed to kind of get closer to the rest of the world to really establish my research career. So I begged King's College in London, who were doing the most innovative gut health research at the time, for a role, and was fortunate enough to get one. So I moved over to London 2015, and I still work as a research fellow, doing all different types of nutrition interventions and looking at how they impact the gut, because it is just such an exciting area and we're learning more and more stuff. But Kate, like you said in the intro, there is just so much misinformation out there. So I think about a year in, working as a researcher, I think I got frustrated that despite the incredible research that was being done, it wasn't being translated. People, because I still in the evenings used to, see clients on Harley Street, just to make sure that my research world maintained relevance. I wanted to make sure, what is the everyday person doing? And really intelligent people were going on crazy diets because they'd heard online that was good for the gut. And it was this huge, lack of science communication that led me to, get into the gut health doctor on social media and abroad.
I love that. And I think it's amazing. 2010. I mean, that seems like now for me, like, if I'm honest, I feel like I've only taken on what gut health is and learned about gut health probably in the last, 5 or 6 years, since I've really been kind of honing in on menopause and the impact it has on the symptoms. I just loved what you said there about, you talked about the gut like it was a real person, because I was blown away recently. And then we are going to come to talk about menopause and gut microbiome. But I was blown away at one of the talks, and I think it was probably listening to you, where I learned about this gut microbiome, the gut-brain axis. Like we have, it's a life form. We have to feed it. And I was like, wow, we have like real, I know we have real living things. That makes me sound really stupid, but like it's a whole incredible, diverse world that we have to feed, nourish, look after. And the impact that then has, as you said, on all these different metabolic functions, and including that gut-brain axis, it is that in itself, for the everyday person who is not a doctor, is completely mind-blowing. And I love learning about it. And, you learn more and more about it, and obviously the different gut microbiome that helps with different things. But bringing it to menopause, like, how does that gut microbiome change during menopause? And why is it so important when it comes to the hormonal side of things?
Yeah, look, Kate, I couldn't agree more in terms of, how we are thinking about this organ like it's its own person, because it really is. Do you know what I mean? Like, it does what it wants, but we can help support it to do the right things. But if we don't look after it, it won't do good things for us, and it will become our enemy, right? And we see it absolutely in menopause, where there's so many hormonal changes happening in the body, and the relationship is very much bidirectional, right? So the hormone changes is impacting the microbiome, but also our microbiome has been shown to impact our hormones. So we do know when we go through menopause that our microbiome starts to reduce down the diversity of the types of bacteria that live within it. And what we see, again, it's very early stages, but what we see is a lower diversity microbiome means it's less resilient. It's got less skills within it. It can do less things. So people who have a lower diversity of microbes in their gut seem to have a higher risk of chronic conditions, more inflammation, poorer mental health, more struggling with weight management, which, is a lot of people, people going through menopause are probably nodding going, I can relate to that, right? So we absolutely know that, there is this negative potential impact on our microbiome, but also what the research has just started to unravel. And I think, another passion point is there has been a real lack of research in women, and particularly menopause. When it comes to the microbiome, it's very much focused on males. They are, to be fair, easier to study and cheaper to study, so that's why it's kind of started there. But, we can only use what we've got, so we're starting to unravel, what we're learning. But in our microbiome, so remember there's a 40 trillion microbes there. There is this group of microbes called the estrobolome. And the estrobolome, actually, what we've discovered is it helps regulate estrogen, right? So when our body's estrogen gets old, it gets dumped into our gut, and usually it's pooped out. But the estrobolome has this unique ability to turn that old estrogen into active and healthy estrogen, and that then gets from our gut back into our system instead of it being pooped out. So actually, looking after your microbiome through the menopause is actually thought to be really important for helping, establish more of an even kind of change in our hormone regulation. So it is, particularly important at that life stage.
Yeah, and that's really interesting to say that, because I think definitely like the women that I work with and come to me in terms of some of their symptoms that you've talked about and what happens, it is that they have put on a little bit of weight, because again, so that sort of sometimes is a byproduct of going through this natural life stage and this change, and they revert to kind of their old habits in their 20s and 30s that possibly served them. It's not necessarily the right way, but might have served them, which is sort of under eating, over exercising, and putting more stress. And then again, what I then see is that they turn to that they're hungry, they have terrible eating habits, they might snack more, not healthy snacks, they tend to drink more alcohol sometimes because they think that that's going to manage many of their symptoms. Obviously it exacerbates their symptoms. So I guess what they're kind of doing is, they're exactly as you've just said, this wonderful gut bacteria that helps manage that estrogen, they're literally not giving it a chance to kind of to thrive and to live, and to then to put back in the body. And I think that is the hardest thing, is to get women to kind of unravel that and to really understand what they're putting in is really going to significantly have such an impact, not only obviously on their gut health, which then has an impact on their overall symptoms. Kind of coming to that, I've mentioned some of those, but what would be some of the common gut health issues that you have seen or that do really arise in menopause?
Yeah, well, I mean, there is so many links with a lot of the very common menopausal symptoms, like hot flushes, for example. Studies have shown that people who eat more gut-loving foods and this plant diversity, and we can, go into some of the particulars, but those people seem to have a lower, risk of having severe hot flushes. And they're more likely to sleep better and those sorts of things. So what we're discovering is a healthy microbiome is actually connected to so many facets that we know, is much harder through the menopause. Those symptoms, whether it is, the hot flushes, the poor sleep, the insomnia, but also things like your bloating and constipation and those sorts of things. And even thrush, there's some research around that as well. So it is, again, like you said, empowering women with this knowledge and this understanding that really starting to nourish your microbiome instead of going on these restrictive diets, which actually can do negative things to the microbiome, actually really can help with those symptoms in a much more healthier way. And just an example, we know that the microbiome helps stimulate GLP-1 hormone, which is actually the target hormone for Ozempic, the weight loss drug, right? So actually looking at just one of the many mechanisms of how nourishing the microbiome, feeding it that plant diversity, the fiber, actually can help, with weight management, which is obviously something that we're all going to struggle with during menopause. We know central weight gain is just one of the side effects, but we need to empower ourselves with the knowledge to help combat it in a really effective and, like you said at the start, sustainable way.
Yeah, it's fun, isn't it? Because you say like empower ourselves and like educate, and that piece is key, because I think we're having these amazing conversations because menopause has sort of really thrown itself out into the spotlight, but it's that early education, that early empowerment, and just slightly coming off track, and then I will come back on track. I have teenage children, and if they hear me say gut health one more time, I swear to God, they will probably dig a hole in the garden and bury me. But they don't understand the importance of it, because we all think we're kind of immune to this sort of thing. And I literally keep on saying, guys, you really need to think, you need to start thinking about it now. And I get it. They're teenagers. They're not going to. But I guess I'm hoping that by having that conversational piece, when they leave the home and they go off to university and they have bad skin, or they have anxiety, or they have bloating, or they have all these things, that the penny might drop. They might have something to turn to if I've given them some kind of foundation. But I think that's really, really hard. Coming to that, because you talked a lot about, you said poop, you said going to the loo, which everyone always goes, oh my God, such a taboo subject. And again, one of the things that women often find again in menopause is that they do have constipation. I think their guts begin to, as we've just established, change. So we've got the gut health, and I know from having listened to you and learned from you and other people in this area that obviously fibre is really important in supporting that gut health role. And I almost think we talk so much about gut health, we forget that, I mean, I know all the foods we're encouraging people to eat are very fibrous, but that we probably undereat the amount of fibre we need to support the gut health.
Yeah, look, okay, there's so many things to pick on. We absolutely are having less fiber than what we need. Most people in the UK are having 20 grams of fiber a day, and we need at least 30 plus grams of fiber a day for optimal gut health. And I think the thing about fiber, just to reinforce, is that human cells can't digest it. So humans don't have a purpose with fiber. And we didn't really understand, well, why are people eating more fiber are healthier? Like, they live longer, they, thrive, all this sort of stuff. And until we understood about the microbiome, we had that light bulb moment. I'm like, oh, humans can't digest fiber, but the bacteria can. So fiber essentially is a fertilizer for those microbes. They have the enzymes to break it down and produce all of these, amazing, chemicals, which then communicate to things like our appetite regulation, our mental health, our liver function, etc. So that's kind of the mechanism behind why, we're always harping on about the fiber, right? And just to also pick up on the kids front, because I've got young kids, right? And if anyone, I know everyone's got all different life stages, or maybe grandkids. And what I find, you've got to target the conversation according to where they're at, right? So because I've got really young kids, I've taught them they've got this little pet in their tummy, and even if they don't like the broccoli, their pet does, and they need to be a good pet owner to look after it. And that really works with the younger ones. But of course, teenagers would be like, Mom, what are you on? So what I, change the conversation to teenagers and just be like, well, actually what we're discovering, and find out what's important to them. Is it being really good at sports, or is it actually, working with, trying to get into a certain university course, and therefore their, brain function and productivity and stuff like that. And explain to them that actually there is really robust studies that show athletes have really good microbiomes, and that actually gives them that edge in their sports. And that's not a lie. There is, clinical trials out there that shows that athletes have particular types of microbes that help metabolize things like lactic acid, so they are able to work out for longer, do PBs and all that sort of thing. And same with the mental health and productivity. So it's kind of working to that conversation, what is important to them, and then highlight how actually the microbiome nourishing that can help. And then, of course, yes, they are going to be teenagers. They're always going to rebel to some extent. But like you said, if I'd known that there was this power and potential in me at uni, I probably wouldn't have binge drinked as much as I did, right? So I'm sure those conversations will certainly be helping. So as you said, fiber is really important, for overall gut health, but then in terms of managing symptoms. But what I would say with constipation is more fiber is not always better, because there's many different types of fibers, right? So we talk about fiber like it's one thing, but there's close to 100 different types, and different types of fibers can work in the gut in different ways. So if you're having a very low fiber diet, slowly increasing the fiber, over several months, yes, can certainly help with constipation. But actually there's a subset of people that I see in clinic all the time where they're like, I'm having loads of fiber. I'm having 40 grams of fiber. What is going on? And actually the types of fiber that they've got, or even maybe their pooping position and that sort of stuff, is kind of holding them back in that department. So there actually is a really good type of, I don't usually recommend loads of supplements, but there is one with loads of evidence if you are struggling with constipation, called psyllium husk. Really low cost, accessible, but it's a certain type of fiber where the bacteria actually can't eat it. So it's a unique type in that way. Because when the bacteria eat fiber, they do produce a little bit of gas. That's why when you have fiber, you want to go slow and steady so you don't get really bloated. But psyllium doesn't actually get fermented by the bacteria. It has this laxating effect. So, sprinkling 1 teaspoon, in some yogurt or in your porridge at the start of the day, starting with 1 teaspoon, working up the next week to 2 teaspoons, and keep going. And the studies have used up to 3 tablespoons a day, can really help with people who are struggling with constipation. If, the fiber, as in just increasing it, hasn't helped them. So there's multiple stages of different recommendations when it comes to constipation, because it's quite complex, really.
Yeah, and I think that's the thing as well, just to obviously say, if anyone is having all of these issues, please go and get help as well, and not to be embarrassed. I think that's the other thing when we sort of have these gut health conversations, and we talk about bowels, and we talk about wind, and we talk about it's still something that people are really kind of uncomfortable talking about. It is really, really important. What might be, I was going to say, some of the signs that a woman's gut health might be slightly compromised at this life stage? Like what is normal wind? I'm putting my hand up here. I'm quite a windy person, but I eat really well. I love my fermented foods, and I'm just windy. That's okay. I don't mind. I've got used to it. So is everyone around me. And I know it's okay. I have all been checked out. I've had all my guts checked out, so I know what's going on. But yeah, what are some signs to other women that they might be slightly compromised?
Yeah, a really good point. There's so many factors, right? So yes, digestive symptoms can be one indicator that your gut health might not be in a really good place. But I think it's so important to highlight it's not just gut symptoms. And this is something that I often see where people are like, well, you know what? I don't feel overly windy, no bowel issues. I must have great gut health. And I'm like, I wish it was kind of as simple as that. But what we're discovering, it's not, right? So there's so many other factors. And when I was writing the first book, I knew, because people always say to me, how do I know if I've got good gut health? I'm on board with it's important, but how do I actually know? So I developed this 10-question assessment. We can just add it to the show notes, completely, free to access. And it helps you get a better idea of where your gut health is on a scale of 0 to 20. And there's 10 questions. So it asks you things like, yes, digestive symptoms, but how stressed are you? How often are you getting sick? How do you sleep? Are you on a restrictive diet? Are you on medications? Because all these sorts of things that actually dictate your gut health. So I always recommend at the start of someone's gut health journey where they're like, you know what, I'm really going to start to investigate this, take the questionnaire at baseline. And then obviously being a scientist, I like to have a quantitative measure of where your gut health is at. And then, do whatever intervention, whether it's increasing different types of plants, relaxing the gut through different strategies like gut-directed hypnotherapy and things like that. And then reassess in two or so months and see whether your score has changed. Because sometimes, seeing a quantitative change can be really empowering to be like, you know what, I am on the right track. Because for things like, mental health and even some menopausal symptoms, it can take 3 months to start to notice that benefit, in a more measurable way. So what I would say is kind of, stick with it. It is quite an important one to think about it as being it's a marathon, not a sprint, essentially.
Yeah, and I was going to come to that because actually I think one of the symptoms that seems to be, again, slightly at the forefront of menopause and a lot of women are experiencing is anxiety, depression, and those mental health, issues. It very much used to be, you go to the doctor, you have to say you've got a hot flush if you want to get HRT, if that's the route you want to go down. And actually, I know for myself, my worst ones were anxiety, heart palpitations, breathlessness, and feeling sort of very, very low. And I know now I was definitely doing all the wrong things. I was drinking too much. I was eating terrible foods. I hadn't quite got myself into the right space. How and why does the gut impact us? Like, how does that? Why do we manifest depression if we've got poor gut health? Like, what's kind of happening there?
Yeah, it is. It is a really, probably for me, one of the most exciting spaces in gut health. Because certainly when I was training 15 years ago as a dietitian and nutritionist, we got told food might have a little role in mental health, but hey, like, let's not overstate it. It's drugs all the way. That's the only thing that we can help with our mental health really in a tangible clinical way. But actually, there's been some amazing, very robust studies out there now showing that following a gut-boosting diet actually can have clinically meaningful improvements in people's mental health. Now, of course, medications always do have a role, and I would never say ditch medications for, a new eating plan or anything like that. But as an adjunct therapy, it really has shown to improve people's mental health in, really quite significant ways. And certainly in the earlier stages, or someone who wants to come off antidepressants with the support of their, prescribing doctor, I've certainly seen in clinic, nourishing the microbiome, working through that process has helped people kind of achieve that goal if that's, where the road that they want to take. So it is, really exciting science. And in terms of the mechanisms, just in case anyone is a bit of a nerd like me and wants to know, well, the gut bacteria and the brain are very different parts. How is this actually happening? There's three pathways essentially. One is via the immune system. So 70% of the immune system lives in the gut. So when the immune system or when the microbes sense something's going on, they're not being fed well, they get hangry, they activate the immune system. That then causes a release of these inflammatory markers, and then that can impact the brain and how we're thinking from that perspective. So I kind of think of that as the alarm system mechanism. The second one is like a mobile phone. And people may have heard of the vagus nerve before, where essentially the microbes activate the vagus nerve and it zips up this kind of, pathway, electric signal to the brain, and that then kind of sends messages that way that, things aren't great and can impact mental health that way. So mobile phone. And then the third one is good old snail mail, postal service, where again, what we're eating and feeding the microbiome, they then produce those different chemicals, as I mentioned before, some of them things like short chain fatty acids, and some of them can actually get into the blood, and some of them thought to pass that blood-brain barrier, and again, having that impact there. So there is really robust science in terms of the mechanisms of it, of how nourishing the microbiome through those different types of plants. And Kate, I'm sure we'll go into some top tips around, okay, well, what do I actually eat for my gut health? But we'll leave that till later.
Yes, no, we are going to get there. But I'm just interested listening to you as well, just then. Because obviously brain fog is another big symptom. So just listening to your point one on that, I'm assuming that again, what we eat is going to have a significant impact on perhaps that mechanism as well, that brain fog. Would that be right?
Yeah, look, in terms of, I guess, where the research is at, hasn't really done much on brain fog as an outcome measure, because they wanted to be a little bit more like depression because it's a harder endpoint, right? But anecdotally, certainly in clinic, I have absolutely seen the same mechanism at play. Starting to focus on nourishing the microbiome does help with brain clarity. And yeah, certainly something that I do recommend to my clients who have brain fog, because like you said, so common in menopause.
Yeah. So we're going to go to that because I want to ask you, how can a plant-based eating support our healthier gut microbiome?
Yeah, Kate, so when we talk about plant-based, I think it's so important that we are all on board with it's not plants only. Totally understand why someone would want to go plants only for, animal cruelty, environmental, cultural reasons. But actually for good gut health, having some certain types of animal foods actually has been linked with better gut health. So things like oily fish, for example. And in fact, there's been some research suggesting that people who have, significant amounts of oily fish on the regular high amounts actually seem to have a delay of the natural menopause. And that's obviously associated with, better heart health and lower risk of osteoporosis. So there are things earlier on we can certainly do to help, delay those sorts of things as well. So yeah, of course, there is the oily fish we know is beneficial, as well as fermented dairy. Again, that's been linked with better gut health. But absolutely the fundamental, I guess, majority of the diet we recommend coming from plants. And that's because the backbone of plants is dietary fiber, and that is the fertilizer for the microbiome. And if those who are kind of like, okay, yeah, I'm quite clued up on that, I'll go a next level and highlight that we now talk about not just fiber, but actually this plant diversity, because there's tens of thousands of chemicals in these whole plants called phytochemicals. And so many of them, again, like fiber, uniquely feed our microbiome. So if we want a microbiome that's really resilient and got all these different skills in it from all different microbes, we need to feed them a range of fertilizers, because, certain types of microbes that focus on inflammation might not like the broccoli. They might want to get the fibers from the quinoa and the peppers and things like that. So really, to have this amazing team of skills, we need to have that a range of fertilizers. So, instead of just getting your blueberries every day, getting your mixed berries. Instead of just getting your one colored pepper, get your mixed colored peppers. Thinking about, it's not going to take extra time, because actually there's so many great products, on the market where it's, the cut up mixed veg already, it's the mixed frozen berries. You don't have to pay more or spend more time prepping. Actually, just thinking diversity at the supermarket wherever you can to feed the diverse range of microbes.
Yeah, I was going to say, you raised a really interesting point there, because I do think whenever I might attempt to sort of talk about, feeding ourselves and doing gut microbe, a lot of people do bring up sort of, the cost of trying to eat this way. And like you've just said, frozen berries you can get, and you can get those mixed peppers, and I'm assuming you can get a bag of mixed peppers as well that are frozen, and it's economically viable for most people. And frozen
100%, and legumes actually.
And frozen food is just as good.
Yeah, absolutely. And I think, yeah, absolutely. And legumes actually are one of my favorite food groups, which I think so many people aren't having enough of. So things like your chickpeas, your butter beans, your kidney beans, and the canned version is absolutely fine. Just triple rinse them, because if you don't triple rinse them, it might create a little bit more bloating because of some of the extra prebiotics. So triple rinse them and literally add them to whatever you're having. In fact, I do advocate people going through the menopause to try get your legumes in every single day. And beyond the menopause, there's been some really great research showing from University of Bergen that adding legumes to your diet can add an extra 3 or so really healthy years. So it has that longevity impact as well, because they're a great source of a P word people will probably start to hear more of, called prebiotics. And that is typically, generally, types of fibers that are really nourishing for certain types of anti-inflammatory bacteria.
See, I think people are, I remember growing up, we did used to eat like a lot of lentils. I think people have kind of forgotten about chickpeas and lentils and black beans and all those lovely pulses and legumes. And there's nothing better than making your own hummus. Like, it tastes really, really good. And something like that is obviously really, really good for you. You've just touched on that, and I did want to talk about that. Was this, like you're saying, prebiotic is becoming a word that more people are talking about. Can you just explain the difference, I guess, between the pre and the pro? And then I do obviously want to ask the question about that probiotic supplementation. Like, what are your thoughts on that?
Yeah, really great question. So prebiotics and probiotics easily confused because they're literally one letter difference, but they're very different things. So prebiotics is that fiber type of fertilizer for the microbiome. So food, think of prebiotic as being a food, and a probiotic, probiotic, is essentially those beneficial microbes. So generally speaking, I very rarely recommend someone needs to take a prebiotic supplement, because if they're eating that plant diversity across what I call the super six, so there's 6 different plant-based food groups, your whole grains, nuts and seeds, fruit and veg, and your herbs and spices, and of course those legumes. So if you're eating across those super six, you're going to get enough prebiotics and you don't need to supplement. But when it comes to probiotics, it's a really, really interesting space in terms of the supplementation, because this is actually what I did my PhD in, probiotics and then prebiotics. And essentially, we've kind of been using probiotics in the wrong way to get a benefit. There is no scientific evidence out there that suggests we should take a daily probiotic off the shelf for good gut health. The way we achieve that good gut health generally is the prebiotic, the plant diversity, feeding those diverse range of microbes, which we pick up from the dirt, from the environment, all that sort of thing. Because a probiotic essentially is a drop in the ocean. But that's not to say probiotics don't have a therapeutic benefit. In fact, there is international health body associations where they've got guidelines where, say, for certain scenarios, we need to get very specific with probiotics and take a specific type. So a bacteria is called a strain in the scientific world. So we need to choose the right strain, we need to take it at the right time, and we need to take it at the right way. An example of that is for thrush, right? So something that, a lot of women struggle with, or bacterial vaginosis for whatever, another kind of imbalance of the vaginal microbiome. That actually is good scientific evidence to take a specific type of probiotic. Now, the strains is LA14 and HN001, and you would take it with some lactoferrin, a type of protein, to help it achieve and survive the survival in the microbiome. And you would take that as soon as you start to notice a change in your discharge. Now, a lot of women are probably going, oh my God, do I need to write this down? But the thing is, with probiotics, we need to get very, specific to have that health benefit. And the same with, antibiotics, right? So you go on antibiotics, and again, the guidelines say you should take a bacteria called Lactobacillus rhamnosus GG, LGG. You would take it at 10 billion units twice a day throughout your antibiotic period and for a week after. So probiotics we need to use in a very therapeutic way to get that therapeutic benefit, not just take a general one. There's no point taking that's a bit of a waste of money.
Do you think we will, at some point in the future, be able to have that unique access to the probiotic that we need when we have that particular ailment or whatever it is? So it is, like your own prescription. So I might come to you and say, I've got, I don't know, thrush. Could you prescribe me those particular things rather than just spending my money willy-nilly on a daily probiotic that can be quite spenny?
Okay, that is my absolute dream. And you know what's so interesting? In many countries abroad, they actually do for some indications. So, for example, if you have to go on antibiotics for whatever reason, they'll always prescribe you a probiotic alongside that. So it is something I'm really passionate about, kind of lobbying with the NHS. But of course, they're very focused on, more treatment versus prevention for a lot of these sorts of things. So they're kind of like, we'll just wait until it gets really bad and you go to hospital sort of thing. Okay. So, there actually has been studies that have shown it will save the NHS, millions of pounds if they start to prescribe, the certain strains at the, the right time, the right way. But so, yeah, I think maybe in 5-10 years it will happen. Yeah. But it is a bit frustrating that it's not getting there.
That? They always like to just, prevention is better than cure. But I think you and I are probably on the same
100%. And for everyone, not only for... Absolutely. And for everyone, not just, individuals' quality of life, but financial, they've seen that can save the government's money. It's just a political thing, I think. But we'll get there. We'll keep lobbying for gut health as a leading therapy, because it actually is starting to, like I said, become mainstream in medical guidelines. So people are, taking it more and more seriously. In fact, there is a political group where we have involved in it in terms of, looking at the microbiome and talking about it at that political level. It's just, there's a lot of hoops to jump through to kind of make change happen.
Well, you've got my vote, so keep going with that one. I'm going to ask, I've got a couple more questions. One thing I do want to touch on, because it's something else I've already mentioned and something I love, fermented foods, because again, I think that's something that's fairly new, I think, to all of this. Are they beneficial for menopausal women? And if so, how should one introduce them?
Yeah, so we know that, there's been studies where people have gone on high fermented food diets. So when we talk about fermented foods, we're thinking about kimchi and kombucha and kefir and those sorts of things. And I've actually shown, it was from Stanford University, people who went on these high fermented food diets had a reduction in some of their inflammatory markers and increased their microbial diversity. So we do think having fermented foods is going to have a benefit. That study wasn't particularly looking at the menopause, like I said. Unfortunately, that's kind of the last on their list of groups to study. Hopefully that will change one day. But certainly mechanistically, it makes sense, given that we're more inflamed often during that period, that it would also have a benefit there. So what I would say, to those listening is, if you don't like fermented foods, it's not essential. If you focus on that plant diversity, then that's going to probably give you the biggest gain. But because of this, research coming out, trying to start to add some fermented foods in your diet, instead of having, your cow's milk in your breakfast cereal, literally add some kefir or some live yogurt. Instead of getting your ultra processed cheese slices, get some fermented cottage cheese, and making those switches to kind of more familiar foods, and then start to get more experimental with things like your kimchi and your sauerkraut, which are fermented types of veg, which are more of an acquired taste. And that's the thing with fermented foods, is the health benefits often come from these different types of organic acids. So they can taste a little bit more tart than probably what our ultra processed food taste buds have been kind of taught. But certainly we know that you can train your taste buds to really enjoy anything. In fact, we've got millions of bacteria in our mouth. And when we start to eat more plants, they actually start to change as well. And studies have shown we start to become more plant loving after about 9 or so weeks of following plants, eating more plants. So if you've got anyone in your family, like my husband used to be very anti-plants. I used to sneak them in without him knowing, like, lentils and bolognese, and kind of still have meat in it, so he wouldn't really know, blend it in smoothies and stuff like that. And now he actually really craves plants. So it does work.
I love that. And I have to say, I love those kind of fermented foods. I've always had a slight obsession with like salt and vinegar crisps growing up. So I think that kind of quite worked. I quite like that sort of tart like kick. And nothing more. One of my favourite meals is like salmon, oven baked salmon. And I will put like kimchi on top of it, and it gives it that kind of, that really sort of crunch. And then that like I'm getting hungry now. And the nice sort of salmon-y piece. And it's just a really, really good meal. What's one essential piece of advice you'd like to give to women caring about their gut health during menopause?
I would say be cautious of, these overly restrictive diets. And you're seeing it on social media all the time, things like cutting out fruit. People are like, oh, that will spike my sugars, and because we're more vulnerable to sugar changes, during the menopause, where hormones are all over the place. We know fruit is so important because it's got all of these polyphenols that we can't necessarily get from the other super six groups, right? But when it comes to fruit, it's having your whole fruit. So I'm not talking about fruit juices and, refined fruit sugars and things like that. I'm thinking about the whole fruit. And actually, thinking about that, having, if you're making muffins, for example, instead of adding the sugar that they ask, add whole dates. Because yes, you're still going to get some of that sweetness from the date, but actually you're also going to get the prebiotics and the other types of polyphenols you find in dates, which can then also help with blood sugar regulation more than table sugar. So it's kind of, thinking of ways to get this great sweetness and enjoying it from whole fruit. So yeah, being cautious of kind of the restriction, I would say. And then, there's so many different things out there, but for anyone, I guess, struggling with their weight, there is a bit of research to suggest eating slightly earlier on in the evening. So if you're normally like end of day 9 p.m. eater, try bring that forward, an hour, the next month another hour. If you can get to eating it, 5 or 6 your main meal. Again, studies have suggested in very controlled environments, but eating earlier changes how our body kind of stores fat. Even though people eat the exact same meals, they've shown that on a kind of genetic level. So yeah, that could be another tip for those who might be struggling.
I love it. You know what? Even just listening to you then, I had so many more questions. I wanted to talk about blood sugar. I would like to talk about fasting. I would like to talk about all of those things. So maybe we're going to have to do, a podcast number 2 to cover all of that, because I think that this is really the key piece that can help so many women at this life stage. And it's like that 1% thing that we can do, and we don't need to overcomplicate it. I don't think anything you've said has terrified me. I think you've painted it all in a really positive light as well. And I'm hoping that people who are listening have taken that as away as well, that this is something that we can all do. It's on any budget. And that, if we do it, can really, really significantly impact your whole menopause experience. And actually, for those of you that do have children, or, you're caring for elderly people, it's beneficial for them too. Like this isn't necessarily unique to the menopausal women. It helps with a lot of symptoms, but this is something for everybody. And the earlier we get those foundations, the better.
Yeah, okay. It's all about thinking of what's in our control, because often I think throughout different life stages of female, we feel out of control, with our hormones. But thanks to the science, we now start to appreciate actually a lot of it is in our control. We just need to tap in to those right things. So yeah, hopefully on a practical level, and absolutely love to come back and do a round 2 with any listener questions as a follow-up.
I love it. Thank you so much. I know everybody will know where to find you because they probably already do. But just in case they don't, what is your Instagram handle? And obviously, where can they buy some of your wonderful books, of which I have obviously got one here. Where can we find you?
So I'm at The Gut Health Doctor, and website is just theguthealthdoctor.com for plenty of free recipes and free blogs and all that sort of sport.
Brilliant. Thank you so much. I'm very hungry now. I'm going to go and eat something really lovely with lots of colour, lots of diversity, and give my gut bacteria a nice late lunch. So thank you so much for joining.
My pleasure.